Hello and welcome to this webinar on infection prevention and control, sponsored by QCS Quality Compliance Systems and Access Skills training provider. This webinar will give you an overview of infection control and prevention and also some tips to deal with the current situation. As you are aware, we are facing unusual times with the threat from COVID-19. I hope this webinar will help answer some of your questions. Infections. What causes infections? So we've got a variety of things that cause infection. We've got bacteria, viruses, fungi, parasites and protozoa. All of these are commonly known as pathogens. Starting with bacteria. Bacteria can multiply quickly at body temperatures, reaching levels that can cause harm fast. Two of the biggest causes of death in the UK are C. diff and MRSA. Two infections add to the winter pressures felt by the NHS, which is also the time we are usually facing increased impact of viruses such as flu. COVID-19 is only adding to this pressure. Viruses. Most of you will know viruses better than you think. It is estimated that the flu kills 56,000 people globally each year, and this is rising on a yearly basis. Viruses can survive on the surfaces and in food, but need a living cell to multiply. They can spread from person to person and from environment to food. Two that we are very familiar with in the care sector is the flu and norovirus. They are the biggest causes of winter pressure on the NHS, along with the two bacterial infections previously discussed, and now we face a bigger threat from COVID-19. Fungi, parasites and protozoa. Fungi live on hosts. One of them that you'll be familiar with is athlete's foot. Parasites such as scabies, which in the care sector we're really familiar with, is very hard to deal with and causes some stress, particularly in group environments. Protozoa such as malaria. Malaria isn't in this country yet, but there is some thought that with our changing climate and weather patterns, it might be a risk to us in the future. Pathogens need certain conditions to survive and thrive. This is called the chain of infection. For now, I will call pathogens germs because it's a term that we're all familiar with. So we start with those germs. They are known, as we've already said, as bacteria, viruses, parasites and protozoa. Where do the germs live? This is called a reservoir. They live on people, animals, both domestic and wild, food, soil and water. They can also live on hard surfaces like door handles, etc. How do germs get out? This is called the portal of exit. This can be from the mouth via vomit and saliva, cuts in the skin and blood during going to the toilet. How do germs get around? This is known as the mode of transmission. So this is contact, hands, toys, those surfaces I've already spoke about, droplets such as when you sneeze, speak and cough. How do germs get in? So this is into the next person. This is the portal of entry. So this is via mouth, cuts in the skin and in your eyes. Next person to be sick. This is the susceptible host. So these can be babies, children, elderly, people with a vulnerable or weakened immune system, and basically anyone. But we all know there are a certain risk group, vulnerable people, and those are the ones at the top of that list. With COVID, babies and children are not thought to be as at risk as other people. Please watch this short video that shows you how easy it is to transfer infections.
Morning, Barbara. Are you okay? To change that dressing of yours that you've had on for about 2 or 3 days. Yeah. Is that okay with you? Yeah. Did you sleep well? What are you reading today? Oh, so you like cooking, yeah?
As you can see from the video, it's very easy to spread infection. To prevent the spread, we need to break that chain. Some links are easier to break than others. Reducing the risk can include safe disposal of waste, safe management of laundry, correct use of PPE, and by far the most important is washing your hands thoroughly and correctly. What does best practice look like in normal times? If in doubt, wash your hands. Take a trip around your organisation or home. Have something messy but safe on your hands. Chocolate spread is usually a good option and quite amusing. Pretend you have been to the toilet and not washed your hands. Walk around for 10 minutes, touching items, shaking hands. How many surfaces and hands have you touched? Best practice states: wash your hands before, during and after food prep, before eating and after eating, before, during and after care. Wearing gloves and apron is good but not a substitute for washing hands. Using hand gel afterwards is also good but not a replacement for washing hands. Before and after caring for someone who is sick. Before and after wound care. After disposing of waste. After blowing, nose, sneezing and coughing. After touching animals and their waste. After handling pets, their food and treats. What does best practice look like during this current threat? Again, wash your hands. Same practice still applies, but with much more care. There is still much we don't know or understand about COVID-19. New advice comes out every day. So now we do not shake hands, we bump elbows, but we still wash our hands afterwards. The current thinking is that COVID-19 can live on surfaces for up to 72 hours. So if you think back to your chocolate spread exercise, those germs will be present in those locations for 72 hours. So it's clear that we need to rethink good practice and significantly enhance it. Let's start with the things we might not have considered before. Today I've heard some thoughts that our post could be contaminated. We wouldn't have thought of that before. It is now thought that COVID-19 can live on our post. How do we get around this? Wash our hands before opening the post and after the post. Ensure service users do the same. Where possible, stop post, use emails. However, I do understand that this will have a significant impact on mental health and well-being, so washing hands is essential so that people can still receive their mail. Along with this, there's the growing trend of postcards being delivered to nursing homes, which people are finding really enjoyable, and this needs to be able to continue. Electronic devices. We need to make sure that electronic devices are wiped and cleaned. Many of you now use handheld devices to put your care planning evaluations on, and these are often taken round service users' rooms. They need to be cleaned often and well. You may wish to reconsider taking them into people's rooms and having them outside the room or in a smart location where they can be updated regularly. Remember, this now lives on surfaces for 72 hours, so those handheld devices, wherever they're put, will maybe come in contact with COVID-19 and will need to be wiped regularly. Let's have a look at our favourite antibacterial wipes. Here's a picture of the ones I'm currently using at home. The clue is in the small print. They're antibacterial wipes. They don't kill viruses. They are helpful and they are worth using, but clearly on the packaging it doesn't say anything about viruses. We still use them to wipe surfaces down because COVID-19 makes people weak, and it's often an additional bacteria that kills people. So still use them, still wash your surfaces, but you can find them that actually say they kill viruses as well. They are more expensive, but they're certainly worth the money. But always wash your hands again. Food delivery is another area that we won't have thought of, but is in the news constantly. The current thinking is the virus can live on the packaging that our food is delivered in. This is particularly relevant to the wholesalers that you have your food delivered from, etc. So what do? Do you wipe all the packaging down? I'm still waiting for an update on this, and we will try to get that update to you as soon as we can. But current thinking, they are suggesting it might well be wise to wipe your food down as well. For now, wash your hands before and after use, and if possible, spoon the contents out of the packaging. Arguably, if you don't use it for 72 hours, then it should be alright, but I wouldn't take the risk. Antibacterial gel. Here's a nice picture of a nice expensive one that I found online. It might look good, and you might think it's good quality because it's so expensive. And in ordinary circumstances, it probably is. But you need to find one that acts on viruses as well. COVID-19 is a virus, not a bacteria. You need hand sanitizer. This must contain 60% alcohol. It's always good to use these things for extra protection. As a virus weakens the immune system, again, bacteria can then take hold. But best practice is still to wash your hands. Please make sure that your hand gel is a hand sanitizer and contains 60% alcohol. Personal protective equipment, or PPE. Again, no substitute for washing hands, but PPE is a must. PPE should be changed between care for service users, during care if needed, if PPE becomes soiled or if PPE becomes damaged. When you've finished giving care, ensure that the PPE is disposed of safely in a bag in that room, and then disposed of in your correct bagging system. Care PPE should not be worn in the kitchen. Kitchen staff should only be kitchen staff and not care staff. I know sometimes rotas mean that people have to do both roles. If this is the case, they should be given the chance to completely wash and change before changing job roles. especially if care is followed by cooking. PPE should also be used when dealing with spills, when dealing with wound care. In some cases you will need to barrier nurse. This is to protect the most vulnerable and those with compromised immune systems. Wearing a mask is not needed in most routine care. However, it is needed when someone is showing the symptoms of any kind of illness that might be a threat to others. If you cough, then do so into a tissue and dispose of it, washing your hands afterwards. Masks are often frightening and lack dignity for service users. What more can we do? We already know about illness and how to report, and clothing and how to keep it clean, and our own personal hygiene, but currently we are being asked to do more. Illness is an ongoing problem. Team members might be unwell and their families might be unwell, meaning they won't be able to work. Schools are closed. Although today you have been listed as key workers, so your children will be able to go to school. What can you do in these hard times to ensure that your service users are looked after? Look at your staffing, have a revised plan in place, ask those who do not have children at home to work longer hours. Many of them will be really happy to do that. If in dom care, can there be visits stopped? Use a RAG system to tell you those that can be. Speak to other organisations and work in partnerships with those other organisations and families. Can you contact team members who have left? Can you ask retired people to return if safe? Not all retired people are in the at-risk group and over 70. Can you change any of your routines? Clothing. As a big fan of eco and the environment, it's hard for me to tell you this, but uniforms should be washed on 60 degrees or above. I know this is against eco regulations and suggestions, but we are in different times now and it is important that we stop this virus. In an ideal world, uniforms would be cleaned and team members would wash and change at work. However, this is not always possible. When they get home, they should quickly change, shower as soon as possible, limit the contact with others until they have done so. Do not put their uniform in the family wash basket, wash their clothes separately and decontaminate the washing machine using a washing machine cleaner. This will offer limited protection as it's antibacterial, but it's worth doing. We do not yet know officially if temperature extremes impact on the virus, but it is still really valuable to wash clothing at 60 degrees. Personal hygiene. It is important to maintain strict personal hygiene before and after work. Showering, washing hair, keeping nails short and hair tidy. Pathogens can live under watches and rings. Keep them to a minimum. In terms of infection control, the old nurse-style watch works best. Work from home and change your working patterns if possible. If not, review your rotas so that vulnerable staff are protected as much as possible. What about dom care? How do you deal with all this if you work in dom care? Review your client list. Is it up to date? Do they still need the same level of support? Can support be reduced or provided in another way? One suggested example is the use of electronic medication prompting. Can the support be shared with other partnerships? This is relevant if you have reduced staffing numbers. Ensure you are safe and reliable with the supply of PPE that you have. Is it good quality? Audit PPE often. Sadly, lots of organisations are finding the basics are being stolen. Carers with symptoms should not work due to the risk of transmission. Carers need to be able to change PPE as often as needed without funding restrictions or limitations. Carers should make sure all surfaces are cleaned with detergents, bleach. Current government regulations suggest this, as they kill viruses. I know this is often against recommendations from COSH, etc., but I think at the moment you'll be alright as this is the current government regulations. Personal waste should be disposed of securely. They should be then put into another bag, tied and kept separate from other waste. Laundry cannot be taken to the laundromat or laundrette if the service user had symptoms. This has to continue for up to 72 hours after an isolation period. If the service user has symptoms, set up a barrier nursing station somewhere safe, using this as soon as you arrive. Coronavirus policy, what should it include? A description of the virus, how and who you will protect, why this is important to protect people, Who is vulnerable and why? Who is responsible and why? Legislations and regulations relevant to health and safety, risk assessment, coronavirus regs, equality and COSH regs. How roles, teams, service users, families, businesses might be affected. How to reduce the risk and spread of the virus using all the advice given above. A description of hand washing should be included. Social distancing. What to do if service users or staff report symptoms. Rubbish disposal. How to raise concerns. Working from home or doing adapted working. Your policy on visitors. At-risk groups. If your policy does not contain this or you need guidance, please use the QCS policy. QCS is a compliance system, quality compliance systems. They provide policy and procedure that shows you how to keep up to date with all the legislation and regulation changes you need to meet. I have suggested on the screen 3 policies that you might like to look at from QCS. We will examine one of them in more detail. This is the QCS Coronavirus Policy HS15. It starts by looking at the impact of the policy, and this one has critical impact. That means it needs your immediate attention. All policies are graded in this way when they are created or when changes are made, and you are alerted to which part is changed by highlighting. As you can see, this also gives you the current legislation relevant to this policy. There is then a section on underpinning knowledge. This is a good source of further information, help and support for you. It then shows you how to meet the key questions, in this case safe and well led, also the legal requirements that the policy will meet. Please note the newly created requirement, the Health and Protection Coronavirus Regs 2020. Scrolling down you will find the purpose of the policy, followed by the procedure section. This section states everything we have already discussed and more. Cleaning of the office, environment and equipment is included. It is vital that you share this information with your team. Scrolling down you will find the definitions and key facts section, followed by further reading lists, which we encourage everyone to use. Please note that it also tells you what outstanding practice looks like. This section I'm sure you will all really like, as who doesn't want to achieve outstanding? All QCS policies tell you this in this amount of detail. Contingency plan. If ever there was a time to think outside the box, it's now. Working in partnership with others and using all the resources you have available to you. What might your plan contain? Staffing levels. Schools have now confirmed that they are closing, with your staff being key workers, so they should still be able to go to school. But what if they are isolated or self-isolating? What will you do then? How will you plan? Look at your staff, see those that have children, those that are vulnerable and most at risk, and plan accordingly. Obtaining resources. We have all seen the shelves empty of basics. How will you ensure you have enough resources? Supermarkets have announced online shopping for the vulnerable and those who are key workers, has been announced today. However, if they are unable to get to the shops because they are working, this becomes irrelevant. So why not think about your wholesalers that you use, and if you can, enable your staff to shop via them as well, having the food delivered to you. You can sort out how to pay for this later, but you can make sure that your staff are getting the basics like fruit and vegetables to keep them going, as they need to look after your service users. Stopping your organisational visits. How will you ensure the mental health of your service users? Think outside the box, use technology such as Skype, Teams, GoToTheMeet, WhatsApp, so that service users can still continue to communicate with their family and friends. Activities are cancelled because no visitors are allowed in. How will you entertain your service users? Several of your regular service users, plus the likes of Coldplay and Take That, are streaming gigs live online. You might be able to obtain access to this. Review your activities programme. Have some little talks. People within your staff and your service users will have hobbies and interesting stories to tell, and might even be able to give little demos. Have a hand washing session daily, using their own bowls and keeping infection control at the top of your plan. Having a hand washing session daily might be pleasurable if you use a variety of different soaps. Have the staff put on a little play on a topical event. There are many ideas that you can use. such as British Newspaper Archive, where you can find old newspaper clippings and have a discussion amongst the service users and perhaps include an afternoon tea, such as the Jubilee. Invent your own board game. Get involved in postcards for kindness, remembering about washing hands because they obviously be delivered in the post. Sign up to the Daily Sparkle. It's quite expensive, but it's good. These are just a few ideas for you. What impact will all this have on new admissions? How will you plan for new admissions? Will you still take them? What impact might this have on your business? How will you address this? There is no doubt that the coronavirus will impact on many aspects of your organisation. Don't take it all on your shoulders. Just get a suggestion box going. Let your team come up with some ideas to support you. For domiciliary care, identify households that are at risk. This will enable you to start planning staffing. Can you obtain the help of others in the household? What could they do? Have you got team members you have who are called floaters or are short break providers? Could they do more? If so, what could it be? Work with your local authority, taking into account their contingency plan. They should have one and they should be able to share that with you. Share with other providers, community services and volunteers. 111, local authorities and health trusts also have systems in place that is to support vulnerable adults who are self-isolating. You should be able to obtain access to this. PPE. There is a free supply of PPE from the pandemic flu stockpile. Today the Health Minister has promised that this is en route to you all. What can QCS do for you? As an organisation dedicated to compliance in the care sector, their experts can keep you up to date with all changes via their gold standard compliance system. What can Access Skills do for you? They can provide you with the most up-to-date and relevant training using a modern and varied delivery model. What can you do? All of the above, plus make sure you remember the impact this will have on mental health, especially those in isolation and service users who cannot see their families. Social distancing. What is it? Social distancing measures are steps you can take to reduce social interaction between people. This helps to reduce the transmission of coronavirus COVID-19. How do you do that? Avoid contact with those with symptoms. Avoid non-essential travel. Work from home if you can. Avoid large gatherings. Does this include family? Yes, it does. Today, weddings have been limited to 5 people. Use the telephone, etc. to contact GPs. Don't visit them if you have signs or symptoms of coronavirus. And remember, stay clean, stay safe, stay calm and be kind.